parts. Intensity of the heat, intensity of the heat not in accordance with the strength of the person or disease, fault in selection of the Sweden type, that are the main reasons to occur the complications. And these complications, common complications are shivering, fainting, skin rashes, and burns. Then mode of action. In that, the Shastik Pinda Sweda mode of action of this, along with its action of the moist heat therapy, it pacifies the morbidity of Vat, Pitta, and Rakta in the skin, afflicted joints, muscles, and soft tissues. It also improves the movement of the joints and enhances the flexibility of the body, soothing effect to the nerves, also improves the blood circulations. Most of the greater increase in skin blood flow with the moist heat was due to the greater rate of rise of skin temperature with moist versus dry heat, while some of the increase in blood flow was due to the moist itself. The procedure not only provides the heat but also medicines. As we know, the process includes Kshira, Balamula, and the Shastikshali. The Svedan makes the skin more permeable by opening the skin appendage through sweating, dilating blood vessels, and all these things helps in absorption of the medicines. Superficial layer of the skin is generally impermeable to the most of the things. Phospholipids present in the milk, which is an important component of the cell membrane. Its amphipathic nature helps in absorption of the medicines. Absorption of the substances through the skin that are depends on number of factors, that are the concentration, duration of the contact, solubility of the medications, physical condition of the skin, part of the body exposed, and the amount of the hair on the skin. The medicines which are used here, that are anti-inflammatory, analgesic, antihistaminic activity, antioxidant effect, antidepressant effect, etc. Now see the last benefits of the Shastik Shali Pinda Sweda. In that, it circulation is improved. In that, after the Shastik Shali Pinda Sweda, skin texture improved, good results in neurological disorders, helps in muscular disorders, muscles gets enough strength, Vata dosha is pacified, relief in pain in arthritis, sciatica, strengthens and nourishes the nervous system. In that also the benefits we see, in that we take the common Svedan procedure. What is the importance? Then important Charak Sutra Chikitsa Stan, first chapter 8 shlok, Snigdasya सूक्ष्मेष्वनेषु लीनं स्वेदस्तु दोषं नयनी द्रवत्वम् स्नेहाक्लीना कोष्ठगाः धातुगा वा श्रोतोलीनाः ये च शाखास्ति संस्थाः दोषा स्वेदेस्ति द्रवे कृत्यं कोष्ठं नीता सम्यक् शुद्धिर्भिः निर्हरन्ति अष्टांग हृदय सूत्र स्थान 17 chapter 29th श्लोक. Thus the Svedan, total Svedan by its attributes, that is the Ushna, Tikshna, Drava, Snigdha, Ruksha, Sukshma, Sthiragura. It liquefies the morbid materials in the minute channels in the body, and which has undergo the proper oleation therapy, and then by its circulatory effect helps them to enter the koshta from where it will be eliminated. So proper, prior to any Shodhana karma, prior to any Shodhan therapy, the Svedan is important one. Now see the case studies. Some cases. This is the patient one. In that, her diagnosis is spastic paraplegia. Spastic paraplegia. She is a 16 years age of the female patient was suffering from Ubhayapada Kriya Hani. Spasticity of the leg, decreased muscle power, muscle tone, along with the aspashta vaka pravrutti since 6 years. Also, history of epileptic patient, epileptic history. Then patient, she has come on the wheelchair. First of all, she will come with wheelchair, and after treatment, first of all, gave her Dipan Pachan Chikitsa, also Abhyanga, other internal medications, and along with the Panchakarma. In that, Abhyanga and Shastik Shali Pinda Sweda done for 1.5 month. And after this treatment, she is able to walk with walker and support. See here, first of all, she is not standing also. Then after treatment, she able to walk with walker and also with support, and her speech also becomes clear. In that, for speech therapy, we give the gave Jiva Pratisaran Churna, but here Shastik Shali Pinda Sweda, it mostly effective in the spastic paraplegia. In second case, second case is growth delayed milestone. 5 years age of male is also unable to walk, delayed milestone, unable to talk also. And Ubhay Pada Kriya Hani, Vak Graha, delayed milestone since birth. And treatment, first of all, gave her the same Dipan Pachan Chikitsa internal medications according to him, along with the Panchakarma Chikitsa. In that also Abhyanga, Shastik Shali Pinda Sweda done for 15 days. And within 15 days, now he is able to stand with support and also able to take steps. This is also from only Shastik Shali Pinda Sweda, and now we have to give him to Shiropichu. This is a third case of the Pakshaghata. The 48 years age of the male patient was suffering from the Dakshina Bhaga Kriya Hani, Vakagraha for 6 months. Also, history of known case of the hypertension and diabetes. After treatment, internal medications along with the Panchakarma. In that also the Abhyanga and Prasarani Taila and Shastik Shali Pinda Sweda done for regular 15 days. Then after a gap of 15 days, again same treatment was resumed for the 1 month. 1 month, and he also improved. Then this is the fourth patient, Pakshaghata. Same, Pakshaghat. In that also the 63 years age of the female patient was suffering from Vamahasta Pada Kriya Hani for 19 years. And Dakshina Janu Sandhi Shula and Shotha for 2 months. She was having the complaints of the grade 3 and grade 4 osteoarthritic changes, osteoporotic changes. And after the also history of the epileptic attack 4 years back. Then treatment after the internal medications along with the Panchakarma, same Snehan, Svedan, Pinda Sweda, especially Pinda Sweda and Yapan Basti were given. After the regular treatment for the 2 months, now the patient is able to walk with support and the quality of the life becomes better. This is the same again the spastic paraplegia. He was 18 years age of the male patient was suffering from the Ubhayapada Kriya Hani, spasticity of the leg, decreased muscle power tone, along with the Vakagraha also. Then Vak Pravrutti 10 years, since 10 years. Also history of the epilepsy, patient came on wheelchair. Treatment first of all gave the Dipan Pachan Chikitsa internal medications along with the Panchakarma. In that Abhyanga Shastik Shali Pinda Sweda also done for 1 month. After the treatment, before Shastik Shali Pinda Sweda, we give some Patrapotli Sweda for 3 days, and after that we gave Shastik Shali Pinda Sweda. Then After the treatment of the 1 month, he shows the sign of the improvement, like he was able to stand with the help of a walker for long duration of the time, and which he was not able to do previously. These are the cases, various cases of the Shastik Shali Pinda Sweda. Now, conclusion. For the conclusion, Shastik Shali Pinda Sweda is commonly used in Bala Chikitsa, as it helps in enhancing the strength, immunity, and nutrition to the tissues. But Shastik Shali Pinda Sweda able to prevent the degenerative changes as well. So therefore, we can use the Shastik Shali Pinda Sweda in the spasticity, cerebral palsy, paraplegia, and neuromuscular diseases, as it helps in improving the muscle tone, gain in muscle strength, and proper nourishment of the dhatus. Along with that, in Keralian Panchakarma, also exception of the Balamula, in Shastik Shali, there will be used the Godhuma. Also Godhum also used, that is the formulation. Another formulation, plain Godhum is used, or Godhum plus Laksha or other ingredients used for the Pakshavada cases along with Shastik Shali. Also in psoriasis cases also, instead of the Balamula, use the Aragvat Patra. Aragvat Patra also used in Keralian treatment. And if the blackish discoloration of the skin is there, also use the Aragvada Patra, Nimba Patra, or Shastik Shali, along with this Shastik Shali. Aragvad Patra, Nimba Patra also used with this Shastik Shali. This Balamul Kvata, except Balamul Kvata, use here the Aragvad and Nimba Patra Kvata. That are the addition of this session. Thank you. Once again, I am thank you for organizing committee. Thank you.
Thank you so much, madam, for such a wonderful, well informative, knowledgeable, and a brainstorming session, because it consists of full explanation of Shastika Shali Pinda Sweda, as well as a beautiful mode of action and pictorial description of all the successful case studies. Thank you, ma'am. And I request participant if they have any queries, so they can raise here in chat box. If participants have any queries, they can raise their queries in the below chat box, or else they can directly unmute themselves and they can ask questions to madam. So if no queries, we will directly go to vote of thanks. So I would like to welcome and invite Dr. Supriya Bhosle madam, Assistant Professor, Department of PG Studies in Panchakarma of our institution, for vote of thanks. Welcome you, madam.
Am I audible, Divyajyoti?
Yes, ma'am. You're audible, ma'am.
Good afternoon, everyone. Myself, Dr. Supriya Bhosle, Lecturer, Department of Panchakarma, SVMMC Ilkal. Namaste, madam.
Namaste.
Amongst all these Vedana procedures, we have the Pinda Svedas, which are widely practiced in all the cases because of its easy applications and multidimensional usages. And today we have with us our esteemed and eminent speaker, Dr. Archana Wadkar, madam. She was my colleague in previous college, my mentor. I'm very thankful to you, madam, for such an enlightening speak. As we have discussed with us, you have discussed with us in regard to Shastik Shali Pinda Sweda, ma'am. It's very easy and very common to other Pinda Svedas, but when it comes to Shastik Shali Pinda Sweda, there is always a dilemma and a query in regard to its preparation especially. And it was very systemic presentation today, ma'am. I think all our students are benefited with that. If even though we understand it properly, they have the dilemma how to write it in the exam, how to put it in the proper sentences in regard to its preparation, quarterly preparation, patient preparation, etc. We are very thankful to you, and plus sharing the clinical studies has boosted this presentation a lot. Thank you so much, madam. Nextly, I would like to extend my thanks to our management members and our principal, sir, Dr. K.C. Das, for their continuous support and inspiring us for such an event. And I would like to thank all the staff of Panchakarma department and other staff of my colleges, PG scholars for their valuable support. Lastly, I would thank my students for their patientful listening. Thank you, one and all. Thank you, madam.
Thank you, Supriya.
Okay, shall we end the session, ma'am?
हो. Leave? Okay. Okay, thank you.